Hi, I'm Dan Frechtling. I am a hospitalist working at JCMC and at Holston Valley Medical Center. I wanted to become a doctor because I have seen in my life how diseases really interfere with people's day-to-day lives. And it's a great privilege to be able to help people start to feel better and get back to the things that they love doing. I chose internal medicine because internal medicine is a field that deals in complexity, deals in gray areas. We do a lot of coordinating of care with specialist services to help our patients get the treatments that they need. And we also manage a lot of complex conditions both in and out of the hospital, and it's possible in internal medicine to develop these longitudinal, long-term relationships with patients that can be really meaningful. The most rewarding part of my job is really twofold. One is oftentimes, we're able to make patients feel a lot better, and there is a great sense of joy in helping people get back to their lives. That day when we were able to get people out of the hospital and back home really feels special. And hopefully we've been able to develop a good connection along the way. Also, as a hospitalist, there's a lot of teaching involved, and I really enjoy teaching the next set of doctors to come the lessons and skills I've developed through my practice. My overarching goal for my patients is that we work together to get them into the best possible health that we can in the time that we have together. I think that medicine really does need to be a collaboration. So I want the patients to understand what we are trying to do to move their care forward on any given day. And I want patients to feel like they were listened to, that I understood as best as I can what was happening in their lives leading up to them coming into the hospital and the situation that they're going to go back to as well. Okay, my ideal day at work as a teaching hospitalist is one where we have a good number of patients that have interesting conditions that residents can learn from, but also that we know through the conversations with the care team and the patient that the patient is actually getting better. If that day ends with some of my patients getting to go home, that is always a win. So I did my training for internal medicine residency in New Orleans, Louisiana, and practicing in New Orleans, I think has really informed how I practice now. It has really given me a lot of appreciation for the things that patients teach you. They tell you a lot, if you're willing to listen, about the area, about their own health, the things they've gone through in the past. And while I know this part of Tennessee is not Louisiana, I think that I see some parallels already, and I'm just looking forward to continuing to learn more from my patients. The thing that I like most about being in the Appalachian Highlands is that it's a really new area for me to explore. There's a new culture here that's very different from what I've experienced in my life growing up in Michigan or in my training in New Orleans. So it's exciting to have a new place and a new people to explore. And of course, Louisiana is very flat as well. And so this is a very different landscape, and I'm really enjoying getting out to hike and explore the natural beauty in the area as well. Hi, I'm Dr. Dan Frechtling. Thank you for spending a bit of time with me, and thank you for choosing ETSU Health.